Hello, Saviours. Welcome to the step-by-step analysis of the questions which are there in the Next Saviours app for NEET PG 2025 and FMGE 2025. The question is from the practice paper 2, the question number 8. The patient presents with a complaint of distended neck pain, hypotension, and muffled heart sounds. Which of the following condition is most likely responsible for this clinical presentation? Now, whatever the answer, based on your knowledge, you have marked, and once you reach the explanation, how the explanation will be written. Now, dear Saviours, the constellation of distended neck pain, hypotension, and muffled heart sound is known as Beck triad. And this question is asked almost every year in any of the competitive examination, which is highly suggestive of cardiac tamponade. All of us are aware. Now, what is the pathophysiological mechanism? In cardiac tamponade, the fluid accumulation in the pericardial sac creates the increased pericardial pressure, which restricts heart filling, leading to reduced cardiac output and hemodynamic instability. Now, this pressure also results in distended neck veins and muffled heart sounds due to reduced transmission of heart sounds through the fluid. So, obviously, this is how the pathophysiological mechanism explains about the Beck's triad. Now, let's also learn the features of all other options, how they are ruled out in this particular question. Pericardial effusion, so may have some distension of the neck vein, but the heart sounds may be distant but not typically muffled. Point number 2, in case of cardiac tamponade, we have already seen that it is associated with the features of the Beck's triad. For congestive cardiac failure, there will be a feature of orthopnea, which should have been mentioned in the question. Paroxysmal nocturnal dyspnea, crackles in the lung, and S3 gallop. And none of these features is provided to you in the question. So congestive heart failure is obviously not the answer for this one. And you already are aware of myocardial infarction is associated with chest pain, shortness of breath, diaphoresis, ECG changes in the form of ST segment elevation and T wave inversion. And it is due to the ischemia of the myocardium due to coronary artery blockage. So this obviously is not at all provided to you in the options. So answer for that question is very simple, and answer for that question is cardiac tamponade. So thank you very much for listening. You see, in order for you not to miss the opportunity of sitting confidently in the examination, there are more than 2,000 questions which are provided in the NEET PG 2025 and FMGE 2025 practice session papers in the Next Saviours app, which is already live. All the best for your future examinations. Give your best shot this year, because this year you might succeed.